At Erie County Medical Center in Buffalo, New York, 15% of patients at the internal medicine clinic are diagnosed with heart failure, but many others go undiagnosed.
Heart failure is diagnosed and classified using a test known as an echocardiogram. This involves placing an ultrasound on the heart and visualizing its pumping function and structure.
Many patients face barriers to care, including the cost of an echocardiogram, finding transportation to visits, and lack of knowledge about treatment. But the echocardiogram is essential. Without it, heart failure often is misclassified and not properly treated.
We performed 5 PDSA cycles. The major components of interventions were to leverage the health information technology to optimize the teamwork and to educate the patients, nursing staff, and the physicians.
The Quality Improvement Team created educational flyers to help resident physicians diagnose heart failure.
It encouraged resident physicians to look for specifically symptoms that we would see in heart failure, like shortness of breath or swelling in the legs, and rather than document them individually, combine those symptoms to suspect the diagnosis of heart failure, and that should prompt them to order an echocardiogram to classify the heart failure.
The flyer also prompted physicians to start guideline-directed medical therapy when necessary.
Guideline-directed medical therapy is a group of medications recommended by the American College of Cardiology, and it's used to treat specifically systolic type heart failure, which is heart failure where the pump function is diminished. These medications work to decrease the strain on the heart and allow the heart to pump more effectively.
Using a shared decision-making model, physicians worked with patients to decide which medications to start, and they provided scales for patients to monitor their weight. The hospital also hired a case manager to help reduce socioeconomic barriers to care.
QI team created an electronic patient registry to follow the heart failure patients and to facilitate the clinic visits from the emergency room visits so the physician can follow up in a timely manner.
The results of the project showed that we were able to improve echocardiogram completion rates as well as increase the recognition of congestive heart failure from a baseline rate of 10% to 70%. We were able to decrease the number of ER visits and the number of hospitalizations for patients with the diagnosis of congestive heart failure.